Kia ora e te whānau. Welcome to the first session in our new series of Healthcast. So this is a space where we can talk about health matters and get some really great insight and advice from our healthcare professionals at Health New Zealand Te Whatu Ora. First, we're going to be looking at the role of immunisations in living a longer and healthier life. And I'm joined by the wonderful Dr. Lily Fraser. Nau mai, haere mai to the Healthcast. Lily, can you tell us a little bit about your role and what you do in healthcare?
Kia ora Beth and kia ora koutou. My name's Dr. Lily Fraser. I'm a GP. I'm from Ngāi Tahu, down in Tuaiponamu. I currently work in two Māori providers, so one up in Auckland, Tūriki Healthcare, and the other one down here in Oamaru, Te Haomaru, Te Whare Koiora.
Kia ora. Welcome. Thanks for being with us today. So, look, we're going to put immunisations in a lens today. And I guess for parents and caregivers, there's a number of actions that we take every day to protect our youngest tamariki. If you think about them, we put seatbelts on our kids, we practice safe sleeping, we safety-proof our homes. And another tool that we should have in our toolkit to keep our tamariki safe is immunisations. So can you tell us what role immunisation plays in protecting our youngest tamariki and how it helps them live a longer and healthier life?
So the immune system is this really incredible thing, and what it does is when it's exposed to different illnesses or vaccinations, it has a memory of that. And so when a baby or a pepe is inside our puku and it's growing, it shares the blood from mum, and in that blood we get the immune system exposure as well. And so when a baby's born, it has some immunity protection to all the illnesses that the mum has been exposed to or had vaccinations against over her life. That will be in pepe when our babies are born, which is pretty amazing. Unfortunately, that immunity from mum wears off over time. And so that's one of the reasons why we start vaccinating at a young age, is because we're trying to correlate with the time that it's starting to wear off from mum. And so different immunity will wear at different times. So as you know, our first immunisations happen at 6 weeks, and there's ongoing immunisations over the early period of our tamariki's lives, because that's the time where their immune system is learning about what the different illnesses in the community. So for our immunity, the immunisations that we choose are mostly the ones that are really quite serious for our tamariki. We still have a lot of colds and other things, gastro infections out there, but the ones that are in the vaccinations are more likely to have serious impacts on our kids.
So what are some of the diseases that immunisation can protect against? And what are some of the things that could happen to our tamariki if we don't immunise?
Yeah, so I think there's a lot going on in the immunisation schedule. There's a huge number of different diseases that are covered. And I think that as whānau, we don't often take the time to really think about or understand what those are. So I think it's important to just have a little bit of an idea of why have we chosen these illnesses to give to our tamariki. So I think, I'll go through some of them just to give you an idea of what my experience has been with those working as a GP. So one of them is rotavirus. So some of us might have heard of that. It's a tummy bug, and it can cause very severe diarrhea and vomiting and fever in our little kids. So I used to work in the paediatric wards when I was a junior doctor, and we would have rotavirus wards because those kids had been found to have it, and they were very sick, and it was very, very contagious. It spreads very easily. And so it's quite hard once you're exposed. All the hand washing in the world isn't going to protect you from rotavirus. And so this is quite a recent addition to our vaccination schedule. And I think it's, remember those very dehydrated little babies in the wards and how miserable they looked. So I think it's really great that we don't, our kids aren't going to get so sick from this illness anymore. It might not stop 100% of cases, but it's definitely going to make it much less severe.
It's good to know.
One that I've never seen in my lifetime is diphtheria. So that's a bacteria. It's something that in the first half of the century, last century, was pretty common. It had a really high death rate, which is one of the reasons that it's pretty great that we've got this vaccination. And what it does is the kind of the serious thing that does, it kind of forms like a membrane across the back of your throat. And so you can't breathe when you've got diphtheria. And so it can be very, very serious. And now, like, I've never seen that in my working career of, 20 years of being a doctor, never seen diphtheria. So to me, like, that's one of the wins of immunisation.
So we're doing well with that.
We're doing really well. Tetanus. So tetanus is in our soil. It's a bacteria. We can't get away from it. It's always going to be there. And that bacteria, when you get exposed to it, it paralyzes your muscles. And so you can imagine, your body gets really stiff, but it also affects the muscles in your lungs. And so if it affects the muscles in your lungs, you can't breathe. So people that do get tetanus toxicity, they often end up on life support because they can't breathe. And so this is, a pretty old immunisation. We've had it around for a lot, and you get the protection from having the vaccine. So now having tetanus is pretty rare in Aotearoa.
It would be.
Yeah, if you get you might have had a cut once, or, you've gone to the doctors for some stitches, they'll often give you a tetanus booster if you haven't had one in the last 10 years, but we protect our tamariki in those early times as well.
Yeah.
Whooping cough. Whooping cough is something
yes.
that we do see, and
It's a biggie.
Yep, I've seen pepe with whooping cough, and particularly in that under 1 year old, it's pretty scary because our
very
babies
scary
cough
and
and cough
distressing.
and cough. Yeah, they cough and cough
Yeah.
and cough and cough, and they can't catch their breath, and it's a real struggle. But I've also seen it in our pakeke and our older people, or if you've got underlying lung disease, whooping cough, you can actually black out from not being able to catch your breath. And I've had someone black out right next to me from not being able to catch their breath from whooping cough. And that's one that does come
Scary.
around. Yep, every few years we've just had an outbreak of whooping cough. And so this is one that requires, because it's still out there and it comes in from overseas, we need a really high vaccination rate to actually stop it spreading. And that's one of the difficulties when our vaccination rates start to drop. Whooping cough usually comes out because it can go from person to person. Polio. So, those of our generation probably
Sounds
know
like a disease
someone.
from so long ago.
So
Yeah.
probably knew someone, a grandparent or an auntie or uncle that had polio. And often they'd have like a smaller leg because they've had some paralysed muscles from polio. But polio in its time was a very common disease. And some people not very severe, but still like a pretty serious disease. The paralysis can last a lifetime. It can affect the lungs as well. And so because of that, sometimes people would pass away from polio. So that's something that through vaccination has been eliminated from Aotearoa. And I've never seen someone with a new case of polio, but it is still in the world. So there's always a possibility, and that's why we continue to vaccinate even though it's not here, because it's not gone from the world. And so someone can just jump on a plane, not realise they're infectious, and no mai haere mai,
Into our
country. Yeah. A really big one in our communities is hepatitis B. So that's another
Yes.
one where it was very common, particularly amongst Māori and Pasifika whānau, that hepatitis B passes through the whānau, whether that's when baby's born or just through close contact, because it's spread through body fluids. And that is a virus that if you get it when you're young, it can stay in your body your whole life.
Really?
Its main thing that it does is it damages the liver. And so for some people, it can cause liver cancer. So we have a lot of adults in New Zealand that still have hepatitis B. We call it chronic hepatitis B. And they get regular monitoring, like every 6 months, having a blood test to check how their liver is doing. And if there are signs that damage is starting to occur, more than we would be comfortable with, then they actually get some specialist assessment, in the hospital, clinic care as well, to try and catch any liver cancers early. So that's something that's still really affecting our whānau now. If a mum has hepatitis B and they're hapu, they're having a baby, then the baby will get some immunity and an immunisation as soon as they're born to stop it staying with the baby. So hepatitis B is still definitely an important one here.
That's really good to know.
Yeah, and so that's been in the vaccination schedule since the 80s. So we're definitely seeing our younger ones a big reduction in the number of people. But sometimes mum hasn't had the tests during pregnancy, it's not picked up, and then babies still can get hepatitis B. Yeah. A couple of really important ones because they cause really severe illnesses are pneumococcal and meningococcal. So they can cause things like meningitis. So I know in my lifetime there's been some really big outbreaks in meningococcal disease where, whānau have died from meningococcal, from meningitis, but also had quite severe disability, like ongoing problems from that illness, like, loss of limbs or things like that. And the hard thing with those two bacteria is our tamariki get sick really quickly. So they might seem like they've just got a cold in the morning, and by night time they're really, really sick. And so if that happens overnight while they're sleeping, hours in that situation are really important. So if a child came to us in GP and we're not that close to the hospital, we think there might be a delay, we will give antibiotics immediately if we think, through a drip, if we think that they might have one of those illnesses, because our kids get sick so quickly and seriously with those. Yeah, so from 6 months of age, our babies can get the flu vaccine, and that's one of those ones like the COVID vaccine where it wears off, and also the viruses change really quickly, and so that's something that can continue annually, for our whole lives. So I think most of us know about the flu. We know when we have the flu how severe that can be. It really knocks even fit adults on their, into bed.
Sure does.
Yeah, and definitely for our tamariki, getting dehydrated and severe fevers. So, even the muscle pain as an adult, you think about our kids, how horrible that is.
No, not fun at all.
The next three, they're in one vaccination together, so that's measles, mumps and rubella. And definitely, measles is something that we still frequently have outbreaks of. We've had them in Aotearoa, and obviously our whānau in Samoa have had a really devastating experience with the measles outbreak or epidemic there. So I think that's something that I think can be underestimated. Sometimes we think, it's just a fever and a rash, but actually it can affect the brain, it can cause pneumonia, it can cause really, our kids to get really unwell. And sometimes it's a virus, so we can't give antibiotics for that one. There is no treatment except, pain relief and fluids. So sometimes that's not enough for our tamariki when they haven't been exposed to these things before. Mumps, I haven't seen mumps since I had it as a kid.
I had it as a kid as well.
Yeah,
Yeah.
so I've
The one disease I remember.
Yeah, and the big neck. Not always a severe illness, but can have some serious side effects, particularly for our tāne. If adult males get it, it can cause infertility sometimes.
Right.
But it is kind of part of that trio. And the rubella, another rashi illness, often mild for our tamariki, but very important to protect our mama when they're pregnant. So
Right.
rubella can, in that early stages, often when you don't know you're pregnant, it can cause quite serious deformities in early embryos when the baby's still forming, and a pretty high chance of problems happening from rubella. So, that's something that previously would have been quite common, but now, we don't see that so much, and that's because of the immunisations. Then the final one from the schedule is called Haemophilus influenza B, HIP.
What is that?
That's another bacteria. And once again, not something we see that often now, but can also cause meningitis, quite bad sore throats where you can't swallow, and pneumonia, other bacteria infections in our body. So it does quite a lot of different things, that one, like the pneumococcal, but like I said, pretty uncommon now. So, yeah, I think they're quite a wide range of illnesses, and really you can see why they've been chosen. They're not just your cold, right? There's some really, I think, serious illnesses that are covered.
Oh, thanks for explaining them to us, because I think we all hear about these types of diseases, but some of us don't really fully understand the implications. And, that's really good insight as to why we really should be getting our tamariki immunised. It is one of the best ways, really, to set them up for a healthy future. And look, I know most people still take their kids to be immunised. They know it's the right thing to do, or it's what they want to do, but some don't. So, what are some of the common reasons, perhaps, I guess, Lily, for people not immunising?
Yeah. I think probably the most common reason is actually just being busy, right? And particularly if it's not your first child. I think we always do a bit better on our first child. But,
Yes.
once particularly if you're working or you've got more than one tamaiti at home, sometimes it just slips by the wayside. And that, I think, is one of the biggest issues that we see, is that you might have got the text and then you moved on to the next text, and it's dropped off your radar for a bit. And I think our kaimahi out in the hapori, in the community, our nurses and our blanket nurses, they do a really awesome job at trying to reach out to whānau and give them all the options. But sometimes your phone has changed, or you've lost it, or you don't have credit to reply. There are lots of reasons why whānau might not get that message, or might not act on the message to actually book our tamariki in. I think for some whānau, they have some hesitancy or some questions around why your child would be vaccinated. They might be worried about side effects, or, there's lots of kind of myths out there around what immunisations can do.
There is.
And so I think it's really important that when you aren't sure, particularly if you're worried about what the vaccine might do, that having a kōrero with somebody that you trust in the hauora system, whether that's your nurse or maybe it's a Māori provider, finding that person that actually can answer your questions and be really transparent around what vaccinations are.
Oh, absolutely, it is. So, Lily, from your experience, I know you've shared quite a few stories with us, but could you perhaps share a story of what can happen if we don't immunise? Perhaps there's a child that you've come across during your time in health and they may have been unwell, and if they had been immunised, it could have prevented perhaps, some of their illness.
Yep. So one whānau that really sticks with me was around the hepatitis B. So this was a whānau, a large whānau who, it was before immunisations were available for hepatitis B. So all the kids caught hepatitis B from their mum, which was quite a common thing back in those times. And so when I was working with this whānau, there was one brother left, and he was in his 50s. So all his siblings had passed away from liver cancer due to hepatitis B, and he was the last one.
Wow.
And so they were really big promoters of hepatitis B vaccination, and he was involved in a lot of trials looking at different ways to try and cure his cancer. But, I really reflected on the impact that had on a generation, and it wouldn't be limited like to one whānau, right? If it's in the whānau, it affects multiple people. So that's something that's always stuck with me is, I'm really grateful for the hepatitis B vaccine, that we're not seeing whole whānau wiped out like that anymore. So that's something that's really sat with me. I think in terms of young children, I remember I was working in an urgent care type of evening shift one night, and a wee little baby, she was only 4 weeks old, so she was still too young to be vaccinated, had caught the whooping cough. And I just remember she'd come out of hospital, and her parents were really worried still about her. And I just, it was really hard seeing how fast she was breathing, and watching her really struggle with her coughing and like really long periods of coughing. And I think, that was at one of those times where our vaccination levels in the community had dropped. And so we were getting this outbreak of whooping cough. And I think that really sat with me as well. And so I think of that little baby, like when I'm talking to our mama when they're pregnant, and encouraging them to get their vaccination during pregnancy to give baby just, a bit more of a chance to get through to their own immunisations when they're a bit older, because we can't, there's always going to be a period of time where we've got to wait for the immunisations to be given. And so protecting the people around is really important as well.
Yeah, it's challenging enough being a first-time parent, let alone, your pepe being really, really unwell like that. So, yeah, it's very important, isn't it? Now, I want to talk herd immunity. Now, a lot of people hear this word and they think, what? Is this about cows or what's the story? But for some diseases, such as measles, right, herd immunity, we're told, protects those of us who cannot be vaccinated, including when you're too young, or perhaps you're undergoing some healthcare treatment and that might suppress a person's immune system. So you talked about Samoa earlier, and we have seen that with the measles outbreak back in 2019. And that was super sad because, over 80 people died there, and most of them were tamariki. Losing life from a population of around 200,000, that's quite a large amount. So that's like, put it in context, say 83 people losing their lives in Hamilton. The amount of devastation that would cause to families and the community would just be enormous. So let's focus on herd immunity. And what would you say to parents or caregivers about the role that immunisation plays in protecting not just their child, but actually the really vulnerable tamariki within our communities?
Yeah, so I think like when we think about vaccination, our whakaaro are always with our own child, right? Like we want to protect our own child from these illnesses. But, when you have very contagious illnesses like measles that spread quickly from person to person, the cough droplets go through the air and they very easily picked up by other people, then the more people that are vaccinated, the harder it is for it to spread. And so measles is very contagious, and to be able to give herd immunity to people, we need to actually have the vaccination rate up to 95%. So that will give those 5% of people, like you said, there are some people that can't be vaccinated. Maybe they've had an allergic reaction to the immunisation. Maybe they're undergoing something like chemotherapy and are immunocompromised. There are reasons why some people can't get vaccinated. Some babies can't get vaccinated. And so what we want to do is try and reduce the chance of an illness spreading through the community. And so with measles, it needs to be pretty high. Things that aren't so contagious, so polio isn't as contagious as measles. So if we have an immunisation level of 80%, that would work for polio. But really, the higher we can for herd immunity, the better, so that we're protecting those whose immune systems aren't as strong, for whatever reason.
Thanks, Lily. And I guess lastly, for a parent or a caregiver who really is just sitting on the fence about getting their child immunised, what final piece of advice would you like to give them?
Yeah, I think back to when I was immunising my daughter, and even as a health professional, and I knew the benefits, taking my daughter in and having a needle put in her was quite upsetting. And so I think that that experience was made so much better by the beautiful nurses that did it. The way that they worked with me to make me feel comfortable. I was allowed to breastfeed her while she was vaccinated. When she was a bit older, we had bubbles, and she didn't even blink an eyelid when the needle went in. I think there are things that we as kaimahi can do that make this experience less traumatic. And I think that I hope that you've learnt something today and you can think of those conditions and go, actually, it's worth it. That those are things that if I can protect my baby against them, why wouldn't I? Because they're serious. And so I think, that's my whakaaro. If you're not sure, find that person, right? And it might not be the first person you talk to, but find the person that's going to really understand and hear what you're worried about, and hopefully they'll be able to guide you through what it means, how we can do it in a way that upholds their mana and their decision around what hauora looks like in their whānau. But I think vaccinations are a really great tool in our kete for being well.
Kia ora, Lily. I think that really does help explain quite a lot to all of us about the world of immunisations and really why they're there and the reasons of why we should be taking them to protect our tamariki. So really appreciate your time today. Thanks for being with us here on Healthcast.
Cool, kia ora, Beth. And thank you everybody for listening. I hope you got something new from this talk today.
Immunisations do save lives, and there's a number of places that you can go to get your tamariki immunised. You can contact your local GP, pharmacy or your other health providers, and to find out how to book an immunisation, simply visit bookmyvaccine.health.nz.